Okay, welcome back to the podcast, episode 239. Good to have everyone with us.
Hey everyone, always a pleasure to be here.
All right, Jenny, so we've been digging into this alliance in the world of medical tech, right? Specifically digital pathology, that crucial step of looking at tissue samples under a microscope, but making it digital.
Right, and as we talked about, it's way more than just, taking a photo of some cells. This is directly related to cancer diagnostics, getting those results back to patients faster, and ideally, making them more accurate, right?
Precisely. So the big news is this partnership between Mindpeak and DigitCells. It's planned to happen nationwide in 2025, which, when you think about it, is actually coming right up.
Very soon. And my understanding is this isn't just like a simple agreement. They're combining some pretty significant, complex technologies here.
Oh man, this is the cool part. So you've got Mindpeak, who, they're the AI algorithm folks. They're the ones focused on analyzing the tissue images with AI. And then there's DigitCells with their system, TWO-D.
Okay, wait, just to clarify. TWO-D. That's a digital way of handling the times physical times biopsy, isn't it? Not just the image itself once it's on a slide?
Exactly. That distinction is crucial. Think about how traditional biopsy handling works. It's very manual, right? A lot of steps for a human to perform. The TWO-D system essentially digitizes the physical handling of the tissue. From the moment it's collected, it tracks its location, its orientation, all that vital spatial data throughout the process.
Okay, so it's like giving the biopsy its own digital identity and tracking system from the start?
Yeah, you could say something like that. And here's the thing about pathology samples. Often you take little bits of tissue, called cores, from different spots within a lesion or tumor. Traditionally, you would often put each of those cores on separate slides, but with TWO-DA, because they're tracking everything, you can get multiple cores onto a single slide while still preserving all that important spatial information about where each core came from.
And that's where Mindpeak's AI really gets a boost, I'm guessing. If you have multiple cores on one slide, the AI can look at and analyze them all together?
Bingo! It enables what they term parallel AI analysis. Instead of the AI processing each individual core image one by one, the AI can analyze multiple cores on that same slide simultaneously. And according to their press release from April 2025, they're seeing some significant gains in efficiency and substantial reductions in operational costs because of this.
Okay, so efficiency and cost savings are certainly important for labs dealing with heavy workloads. But how does this integration, the AI working with the TWO-D system, how does that actually improve the times accuracy of the diagnosis itself?
Which is, the core purpose here. That's where Mindpeak's algorithms come in. Their AI is trained to do some pretty involved tasks like segmenting tumor areas, quantifying specific protein markers within the tissue. These are tasks that, when done manually by a human, can have some inherent variability depending on, who's looking at it. The AI provides a consistent, objective measurement.
So it's about minimizing that potential variation you might get between different pathologists examining the same slide?
Exactly. It's designed as decision support. The AI isn't there to outright replace the pathologist. It works alongside them, giving them a powerful tool, a consistent starting point, or highlighting specific areas of concern that need a closer look. Mindpeak's CEO, Felix Faber, specifically mentioned the strong synergy between their AI and DigitCells workflow being a significant benefit for pathologists.
And Jim Liu, the CEO at DigitCells, they talked about streamlining workflows and, redefining diagnostic standards through this. It sounds like they definitely view this as a pretty substantial step forward, not just a minor update.
For sure. They're starting with breast and prostate cancer diagnostics, which makes sense given how prevalent those are. But they're not stopping there. The plan, as of that April 2025 announcement, is to expand into gastrointestinal and dermatopathology by the end of 2025. So adding GI and skin biopsies.
That's interesting. But how does AI adapt to such different types of tissues and diseases? GI, and skin biopsies can look quite distinct under a microscope, right?
Good question. Developing effective AI for those areas requires a whole new data set of training data and significant fine-tuning of the algorithms for the specific characteristics of those tissues and diseases. I imagine that's a significant technical undertaking, but it definitely signals their broader vision for applying this technology across a wider range of pathology subspecialties.
And this nationwide rollout, they're doing that through Diagnostics, who, as we know, have a nationwide presence and a pretty strong network, right? They've been in the field for over a decade, with a team of 150 professionals.
Yep. That existing infrastructure is key for enabling relatively quick adoption across the country, because it's not just about building the technology. It's also crucial to get it into the hands of the labs and the pathologists who will actually use it day to day.
Okay, so we've covered the technical side, the efficiency gains, the expansion plans. What about the flip side, the ethical component? When we talk about AI making diagnostic suggestions, that brings up some weighty questions.
Absolutely. A common concern with AI in healthcare is often referred to as the black box issue, where the AI provides a result, but it's difficult to understand how it arrived at that conclusion. Mindpeak explicitly states they're focusing on providing transparent and interpretable results. They want to show the pathologist why the AI is making a particular suggestion, highlighting the features in the image that influenced its analysis.
Which, I would assume, helps build trust in the system. But then there's the question of accountability. If, say, the AI were to miss something, who is ultimately responsible in that scenario?
That's a complex issue, and honestly, it's one that the entire medical and ethical technology community is actively working through. The AI here is positioned as decision support, meaning the final diagnosis is still the responsibility of the human pathologist. However, it certainly highlights the need for clear standards around AI training, rigorous validation procedures, and developing robust regulatory frameworks as AI becomes more and more integrated into clinical workflows.
And data privacy, of course. Digitizing all these detailed biopsy images and associated patient information, that's incredibly sensitive personal health data. How is that being protected?
DigitCells states they are using a secure cloud infrastructure for their system, which is the standard for modern digital health platforms. It's built with data protection in mind, utilizing encryption and access controls. But like any connected system, cybersecurity isn't a one-and-done thing. It's an ongoing effort that requires constant vigilance and updates.
Right, it's a persistent challenge. So looking forward, beyond the stated GI and dermatopathology expansion, what other future trends might we anticipate seeing emerge from this kind of partnership?
I think you'll likely see further integration of AI directly into existing lab information systems, aiming to make the AI analysis something that pathologists access seamlessly within their current workflow, rather than having to jump to a separate system. They also mention plans to publish comparative studies, which is important. Rigorous, peer-reviewed research showing how their integrated system performs compared to current manual methods. That kind of evidence is essential for broader clinical buy-in.
Validation is indeed key. And, we probably won't get significant real-world user feedback until after this nationwide rollout actually starts happening in 2025, right?
Exactly. The real test comes next year, when labs nationwide begin using this system in their daily routine. Will pathologists find it truly intuitive? Does it genuinely save them time? And, importantly, enhance the accuracy of their diagnostics consistently? We'll need to keep a close watch on the post-rollout phase.
It seems like a significant pivot towards a more digitized, AI-assisted future for pathology overall, streamlining how tissue is handled from the very beginning, then layering on powerful AI analysis. It definitely shows promise to make a meaningful difference in how cancer and other diseases are diagnosed and potentially treated.
It genuinely does feel like an important step. Merging the physical handling of the sample with the digital analysis of its data, it feels like a very forward-thinking approach. Combining sophisticated hardware with complex, intelligent software is clearly where the future is trending in medical diagnostics.
So, efficiency, cost benefits, enhanced accuracy potential, and definite plans for broader application. This partnership is certainly something worth paying attention to in the medical tech space.
Agreed. And it's a really good illustration of how different technology companies are finding ways to collaborate and tackle complex problems within the healthcare system. All right. I think that gives us a good overview of this Mindpeak DigitCells alliance for now.
Fantastic. Thanks for walking us through it, Mark.
Always a pleasure, Jenny. And thank you all for tuning in to episode 239.
We'll catch you all on the next one.